Good afternoon to the curious audience. My name is Albert Bravo. I would like to take you through an experience that 26 million people exactly like yourself are going through as we speak. Please block your mouth with your palm, closing your nostrils with the thumb and the index finger. Now empty the whole content of your lungs and try to inhale as fast as possible while your palm is blocking your mouth. Did you feel a severe lack of oxygen? Feels familiar, isn't it? Can you imagine yourself wearing a tight mask till the end of your life? This is exactly how a heart failure patient feels while trying to climb up the stairs. Heart failure doesn't kill. Like heart attack, much worse. It dooms the patient to endless amount of hospitalizations and day-to-day struggle for oxygen till the end of his life. Given early detection, heart failure could be prevented and hospitalizations reduced. Unfortunately, contemporary heart failure diagnostics are invasive, expensive, not scalable, and simply can function as preventive tools. The outcome is that only in the US, the cost of heart failure is $39 billion of taxpayers' money, and it occupies 43% of all Medicare spendings. Believe it or not, but heart failure consumes 2% of the whole healthcare budget in the US. In fact, heart failure is responsible for more hospitalizations than all forms of cancer combined. To prevent it from happening, Zencorlabs had developed the whistle. Once the patient has located his finger on the camera of his smartphone, we start the pulse wave signal acquisition. After 20 seconds of measurement in rest condition, the patient begins the controlled Valsalva maneuver by blowing the whistle to 25 millimeters mercury units of pressure during 20 seconds. The developed pressure is transmitted from the whistle to the smartphone via BLE in real time and displayed on the third graph of the app. The main idea behind the application of Valsalva maneuver towards heart failure diagnostic is that the controlled pressure applied on the chest via Valsalva maneuver stimulates the heart to change the pulse wave measured from the tip of our finger in a way that allows reliable diagnostic of heart failure according to clinical standards. The result of the test is a clear picture of current heart failure status described as heart rate versus pulse pressure curve. We call this curve the Zencorlabs, and it is highly correlative to the LVDP parameter measured by the invasive methods. Our test allows any healthcare professional to have an objective real-time feedback on the efficacy of the prescribed heart failure medical treatment. As much as a diabetic patient measures his blood glucose before the meal to decide how much insulin he needs to take, a heart failure patient is using the whistle to determine the intake of minimal amount of medications to avoid side effects but still stay away from hospital. To generate revenues, we use the Gillette razor blades model to sell disposable filters to healthcare professionals. Our onboarding package is a free Zencor app, $60 for a whistle, and a package of 30 filters free of charge, while we sell each filter for $4.99. We are here today to offer a piece of Zencorlabs to those who will help us to implement this model in Europe and the US. Moreover, Zencorlabs is already certified and going to obtain the reimbursement in Germany via the digital health application, so-called DIGA program, until the end of 2020 21. Together, we're going to make sure that no whistleblower will ever have to compromise on his or her quality of life due to misdetected and untreated heart failure.